Welcome, everybody, to another episode of the Beyond Train podcast. I'm your host, Liam Dalton. Today, we're going to continue our discussion on, psychology, sort of. We're going to touch on interesting little niche of it. We're going to talk a little bit about psychiatric drugs today. Really looking forward to this discussion. We've delved into the philosophy a little bit with Dr. Kaufman and Mr. Whitaker there, but today I think we're going to get a little more into what it actually looks like more boots on the ground stuff. So I'm really looking forward to this. We have Dr. Julia Britz on today. Stumbled upon her on Instagram, and um, she had an amazing page. She shares some amazing information, and I'm really looking forward to having a conversation with her today. So, Dr. Britz, thank you so much for coming on today.
Thank you. It's gonna be fun.
Great. So, start all my podcast episodes off with a sort of more general question, and it is general and it is broad. I ask all my guests, what is health? So, it's almost like a definition of health or how that manifests, what it means to you, and so you can kind of take it wherever you want to go. So, what is health?
Well, to me, health is sort of the barometer of how we're doing on a spiritual, physical, and emotional level. And that makes it sound like it's a place or a state of being, but I think that's actually a terrible way to think about it. Because if we start thinking of health as a goal and then we kind of see it as like, oh, I got to get to the finish line of health, it puts us in a state of healthism. And healthism is like, oh, I don't know if I'm healthy enough. And I don't know if I'm perfect enough at being healthy. And it becomes kind of dogmatic. And that can be really disheartening to the state of health. So for me, I think of it more as an adjective. Like I am doing things that help me feel healthy, or I'm doing things that do not help me feel healthy. So it's more like an active state of being versus a goal we're trying to reach.
Amazing. Yeah. I really appreciate that. And you bring up healthism. That's interesting. We haven't talked about that ever on the podcast, but I feel like we all sort of go through a period, maybe not, but I know I've been through a period where I've been like, you know, gotta avoid all the toxins. And I'm still, I mean, my fiance would certainly say I'm still there, but and like to the general population, they'd be like, you're a nut. But I've been worse in my head, and the stress associated with trying to be healthy, like
Right.
you're mentioning there, like trying to achieve the state of health, it's impossible. It's like trying to be rich. When do you achieve being rich? It's
Right.
like if you're gonna chase money, you're never gonna get it's just gonna be disappointing forever. So it's kind of along the same lines. Like if you're trying to chase health as the state, and it's sort of interesting, right? Because you want to feel healthy, but it's not necessarily this sort of state of being in a way. I don't know if that makes any sense at all, but maybe you want to chime in on that.
No, it does because health, the wellness community became very niche. It became like, and we created terms for things that don't need them. Like, oh, you're putting your feet in the ground, you're grounding. Like, that's ridiculous. Like, you're just walking outside. That's so stupid. But, we do that because we have to encourage this behavior because it's become alternative. It didn't used to be, it used to be normal. But now that it's become alternative, it's become niche, it's become unique, it's become in some aspects, more, like I said, dogmatic, even cult-like at times. I mean, I think we've all heard people describe that about different dietary choice groups, like, oh, that's too hardcore to be a carnivore, it's too hardcore to be a vegan. So it gets really sected. And I think if it weren't that way, if it became more again our normal way of being on a consistent daily basis, we wouldn't ever really even think about it that much. It'd just be like breathing, just something you do, just part of your life. It wouldn't be weird, and you wouldn't be thought of as weird or extreme for caring about the toxic burden in your life. People would just be like, "Oh, good," it just wouldn't even be a thought. But it is a thought, which leads to us putting like us in our own positions of obsession. We have to like, okay, well, that's a rabbit hole. Like you just do. You get into these rabbit holes about every other health thing you could think of because you're just trying to get on top of this garbage area of toxic burden that we live in now. So
Yeah, awesome. Yeah, no, I agree, and like it's also like it's interesting the way that it's viewed now too, because I'm at a point where I'm not. I would never consider myself to be on some sort of diet or any sort of restrictive diet of that matter. my diet in quotations is to try and eat whole foods only. You know what I mean? Like, and I mean minimally processed as well. Like you process stuff in your home. We can get into the definitions of what is processing, but processed at home, whole foods, and then that's considered a diet. It's like you're not even a vegan or a carnivore or whatever. You eat real foods, and people are like, "Oh, you're not eating Oreo cookies. You're on a diet." You know what I mean? It's kind of funny, eh? But anyways, it's a different world now. I for personally, my philosophy sort of align myself as much to nature as I can. And that's just kind of how I view it. Like you said, like we have to make up these terms for grounding, and then there needs to be scientific evidence for why grounding is beneficial. But like I'm at the point where it's just, if you align yourself with nature, that tends to be the answer. At
Right.
least it's always proven itself to me for sure. Um,
Yeah, it does. I mean, on one hand, it's very reassuring to read an article that says, hey, it's actually really healthy to incorporate eggs in your diet. Like that feels good. At the same time, you could find another article that says, don't ever eat eggs. These are really bad for you. And so it's a tough position because we all are confused. And I think we have every right to feel confused because there's things in our world that didn't used to be here. So, if we went back to how we used to live, more community, more nature, we wouldn't have the choice. Or like for me, I have to go very far away to find a park, So that study I read on, oh, you need 15 minutes a day walking around greenery that will help reduce, inattentiveness. Like, okay, well, I need that kind of information to tell people. Otherwise, it's hard to justify, like, driving out of your house trying to find a park. It's not easy anymore. So I have a lot of empathy because I experience it too. Like, we all are trying to find the balance of living in a capitalistic world, which doesn't really, I think, cater too much to a naturalistic spiritual world. I don't know how they go hand in hand. I think we're all struggling trying to find that balance.
yeah, very well put. Very well put. I agree. Yeah, and it doesn't help when you're told, and the thing about social media too, my goodness, you can find anything on social media, and it is the same with the literature, like you pointed out. Like you can really argue any side and have the literature to back it up. And obviously there's a lot of fraud in the literature too, which doesn't help, and there's a lot of vested interests, and a lot of the authority figures tend to push this sort of materialistic modern approach, especially to health, whatever that is, right? But yeah, no, that's really well put. So today I do want to talk about, more psychiatric area of things. Maybe I could just hear a little bit about, how you got to this point in your thinking, what maybe a little bit of your journey, how you got to this point, and I'll just give you the floor and we can take it from there.
Yeah. I think as a little kid, I struggled with, like a lot of kids do, anxiety, emptiness, worthiness, depression. And my very, I think, well-meaning mother would always threaten me with, if you don't feel better, I'm gonna take you to the doctor, they're gonna put you on psych meds. So I learned very early on that psych meds were punishment. And so I never really like trusted medications. Even when I got I had a yeast infection when I was a teenager, and they're like, let's try a medication. I was so scared of that. And so I had a probably an irrational fear around medications for a long time. And it eventually got to a point where it was a very real discussion about, like, hey, your OCD, Julia, is way too severe. Like, we really should talk about Zoloft. But I was so afraid of the weight gain. I knew that was a possibility. I knew sexual dysfunction was a possibility. Um, and even JAMA says that over 50% of people on SSRIs will experience weight gain. So and sexual dysfunction. So it's not that unlikely. I felt more comfortable though getting medications across the border. I go to Mexico and get Ativan and take it just as needed. I like that it was fast acting. So there's the irrationality for sure. But I knew there were things I was giving up though. Like I was feeling better OCD wise, but also I was getting blackouts during the day. I couldn't remember a lot of things. Um, and then I also had some interesting types of sexual dysfunction. So like I couldn't experience an orgasm at all, even though like I was still experiencing libido. My spatial awareness was pretty poor, so I was constantly bumping into things. I was hallucinating, but it didn't scare me because I knew it was a hallucination. So I was always seeing rats everywhere. But so it got to the point where I was like, you know what? I don't know if what I'm paying for the relief of OCD, I'm not sure because it seems like I have to constantly pay more and more to do this to kind of be, not even symptom free, just have like the edge taken off during a panic attack. And it wasn't until I forgot to take my medication that I went into withdrawal. And I woke up one morning and I could barely see. I was sweating. I had this vibration stuff going down my spine. And I was hysterically crying. And I didn't know what was wrong with me, but I knew something very erratic was going on. And then it took hours. We finally realized that I didn't take my medication. So and that's what I hear a lot. It's like, it's not that people are like, I'm addicted per se. It's just my body's dependent on this stuff. And that's when I was like, I got to get off this stuff because this pill is way too strong. It's actually everything to me. And the thought that maybe one day I won't be able to get it if I need it really scared me because the laws were changing in Mexico all the time. So, um, from there, let's go to med school. I didn't want to go to med school. I wanted to actually originally be a psychiatric nurse practitioner. And I was like, I don't want to do that. I don't want to, deal with that system. I didn't want to be in the system. I didn't like the system. I didn't want to work in insurance. So then I was like, I got so much better with naturopathic medicine. I loved it. I just loved it. So I was like, I'll just do that and help people that are struggling either with, I'm on a psych med, I want off, or I don't want to have to go on this medication. How do I deal with my anxiety? Like that's what I wanted to help people see was that there was a third option. It didn't have to be just pharmaceuticals or therapy. And I love therapy. I love therapy, but it's not always accessible and sometimes it's too expensive. And sometimes people are just not emotionally ready to talk about what they're thinking with somebody else. So I wanted people to see, I still do, like there's got to be a third option than just what we're given. So that's how I got to where I am now. And I actually feel really honored to be able to do what I do because it's it's such a difficult road to come off of medication. Um, but it's so rewarding when people do it and people actually feel like they're who they're really supposed to be.
Amazing. Yeah. Yeah, that's an amazing story and journey to where you are now. That's big, and they often talk about, when I listen to the sort of more modern side of things, they always talk about this, they're not addictive, so they must be okay or whatever. And there was a cool analogy that I heard. It was like, people will say like, you know, with coffee. Well, I'm not addicted to coffee. Like, if I stop coffee, I'm not gonna. Well, I mean, some people I think are addicted to coffee, but but you still have some sort of reaction, some sort of bodily reaction when you do come off of drinking coffee. If you're drinking coffee all the time, um, it is altering this sort of baseline homeostasis balance of the body, if you want to think about it that way. So it's sort of making like a new normal in your body, right? So there's this new normal, and then once you stop having that input, things are bound they're bound to be different, So I think that's a really important thing to highlight, that even though like they'll say like, oh, SSRIs aren't drugs of abuse, like people aren't going to go out on the street and buy them and sell their fridge for SSRIs, it doesn't mean that there can't be any sort of withdrawal, can't be anything like that. So I think that's really important point. Um, Meaningful work. This certainly sounds like a meaningful area for you. You can hear the passion in your voice too. I'd love to hear. Maybe we could start with maybe discussing side effects. Um, and we could start less so maybe with the specific side effects, but we could maybe discuss what's your perception on the transparency of side effects being conveyed to patients, like in the doctor's office or through the literature, education, stuff like that. I'd love to hear your perspective on that.
Yeah, I mean, they're just not conveyed at all. And I have a little sympathy, a teeny bit for the docs. I do, but most of it I do find to be pretty irresponsible. It's we're not given informed consent. Like, hey, if you take this, This is what could happen. These are the red flags you need to watch for. These are your alternatives. What would you like to do? Doesn't happen, you know. Um, and I understand what it's like, you know, for a doctor, or you have someone in your office who's suffering and they're begging for help and you can see it and they're wanting reassurance. So you're trying not to scare them more. Like, I understand. So how do you do that? How do you give someone true informed consent while trying to manage emotions that that patient can't manage themselves, you know, when they're truly needing help? So it's a delicate conversation to have. And I wish more people would get that conversation. Because the side effects, which I think are kind of hilarious in a very dark way, most of the time with SSRIs and benzos, it's going to be sexual dysfunction, meaning inability to have an orgasm, low libido, or some sort of change in ejaculation. And this can actually go on even after the discontinuation of the medication. So and that's a really big deal because I see this a lot in women, especially because women over age 60, they're prescribed more SSRIs and benzos than in any other age group. So um, I think the issue here is that I do see a lot of women that will be like, look, I don't know. I've gone through menopause. I don't care about sex anymore. You know, so they don't quote unquote mind. And I get it. When you're suffering, it's the last thing on your mind, sexual health. But I always tell people sexual health comes from the sacral chakra. This is the same area where we have our creativity source. This is where we can self express. And that's why most people tell me, like, when their dopamine's low, they're like, oh, like, I don't have libido. I don't want to do anything. I used to have all these great ideas. I don't have them anymore. I used to be like ADD and I had all these amazing thoughts. Now I just have ADD, but not the amazing thoughts. I'm just anxious. That's what happens when sexual energy and creativity are gone. So that gets robbed of people when they go on a psychiatric medication. So even though it's a pill, and it's like, oh, sweet, I have this medication and I get to take a pill and hopefully we'll turn this down. You are going to pay for it. You're going to pay for it with not being able to control your metabolism, your weight gain. There's going to be issues with more urinary tract infections are pretty common, headache, gut dysbiosis is super common, insomnia or hypersomnia, fatigue, low energy, changes in the skin, acne sometimes, especially with stimulants that cause more dry skin acne. Um, there's going to be, and of course, a risk of dependency with every psychiatric medication. And I mean, I'll get argued about that one, but it's true because, you know, it's funny, like benzos, they work on the GABAergic system. So the argument is for a long time was, well, they can't be addictive because they don't work on the dopamine system. Well, I would also say neither does alcohol, and look where we are. So, the thing about benzos and alcohol is that when you hyperstimulate the GABAergic system, the body has to counterbalance by releasing dopamine, otherwise, you will stop breathing. So, if you don't have enough dopamine to come in, then we can't actually just function. We'll just start to real quick. So, when we get that secondary influx of dopamine, that's addictive. That feels good. So, you're actually able to feel a sense of calm and alertness without that hyper anxiety piece that comes from just the dopamine hit without the GABA balance there. That part is what keeps that brain going. I need more of that. I need more of that. Even if, like, psychologically, you don't feel that way. Like, I didn't. You know, I woke up and I was like, I have no idea why I'm in withdrawal. I didn't know I was because I didn't crave my med. Most people don't crave it. Some people do. Um, but I think there's no such thing as an easy fix or a magic pill. It just doesn't exist.
Especially with something so complex as the psyche, it's sort of interesting as well. If it's if we could talk about the causes of um, mental health conditions as well. But if there's a psychological cause to it, you know, is it possible to correct that through some sort of neurochemical pathway? Like, can you address that through the material, through the chemicals? If it's caused by something in your environment that's on the psychological realm, that is amaterial. How are we supposed to approach that then?
Right. And to me, that was the worst thing that ever happened to the practice of psychiatry and psychology was when 1952, I think, they were like, let's just split it up. The psychotherapist, you guys can have the mind, you bunch of hippies, and then the psychiatrist is like, okay, you real scientists, you can play with the bag of chemicals that are the people. And that severed the mind body connection, killed it, you know? And so that's a problem because even now, there is some really cool research showing that if somebody has physical stress and experiences oxidative stress in the body, free radicals, that same thing can happen from emotional stress. So the body doesn't know the difference. The only stress it doesn't see the same is excitement stress. So if somebody's like, I can't wait, I'm jumping out of a plane, that won't cause oxidative stress. But if someone is stressed over divorce, that will. That also will if that person overtrained at the gym and didn't drink any water and, they had a cold at the same time, like all that stuff. So that's all going to lead up to the body getting more oxidative stress, which translates to more systemic inflammation. So, with that being said, since we have multiple ways to alter the chemicals in the body, physical and mental, we can sort of jump in at multiple areas. And that's why I encourage people like, hey, we're going to work on the physical stuff. We'll work on the nutrient deficiencies and the nutrition and all that. But therapy also is going to be crucial because if we don't change the thoughts that have stemmed from this, then we're not going to be able to self-soothe, emotionally regulate, and keep those stress chemicals from popping back up all the time. If that makes sense.
Yeah, definitely. No, absolutely. That's an interesting point you make about in the 50s there, the separation of the mind and the body through the splitting of psychiatry and psychotherapy. That's something I haven't really thought about, but um it seems obvious now that you pointed out because that's when half of them put the coats on, the white coats, and then the other half
Mm-hmm.
were they were the Freudians, they were the Jungians, they were sitting in the couches laid back and
Yeah.
yeah, that makes a lot of sense because that did really split the fields off. And it's interesting too, that psychiatrists are like, they certainly believe that they're still primarily concerned with the mind from a chemical perspective, which I think is sort of an interesting take. Um,
Yeah.
and we could I don't know enough about the brain to comment, but the only thing I know about the brain is that we don't know anything about the brain.
Right.
Really, that's really my perspective on it. If I can make
Absolutely.
such a comment, but yeah, that's really interesting. I'm curious, you mentioned earlier about sort of withdrawal. Maybe we could talk about that generally, and then I might have a few more specific questions about it. Yeah.
Yeah. So, the standard would be that no matter what psychiatric medication you're on, and I include psych meds as the following. That's going to be your stimulants, your SSRIs and your atypicals, your benzos, SNRIs, and the mood stabilizers and the antiepileptics. Depakote, lamotrigine, those guys. So, any of those medications do carry a risk of dependency. So, what that means is that if you come off the medication, whether extremely quickly or extremely slow, there is a risk of experiencing withdrawal symptoms. And that's because when you don't have that steady state of the medication in your blood anymore, the body is going to react and try to compensate. That compensation doesn't always feel really good. So, and it's not that the body's doesn't understand, but in a way, I guess it doesn't understand. So it's like if you're taking medication to sleep and then that medication goes away, your body's like, oh, I'm not getting the stimulus. To sleep. I guess they don't want to. Okay, don't want to sleep. They want to be awake. Give them insomnia. Body's trying. It's just listening. The body listens. So when we go through withdrawal, some people are very lucky genetically, and they will not experience a hard time at all, and they'll just come off it, no problem. Other people, it's going to be a more challenging process because the body can be very sensitive and doesn't like a lot of change. And we do that anyway with people that have a lot of anxiety. A lot of them tend to be very highly sensitive people. Sounds, smells, emotion, everything sensitive, sensitive, sensitive. So changes in medications, sensitive. So withdrawals are going to be different for every medication class. And I think the most important thing to know is that usually the withdrawal, um, people will be told at some point, like, okay, be really careful. This is maybe your underlying condition coming back, which is not true. And science does not show that's true in the research. So it's, for example, someone might be on lithium carbonate, and then they'll come off it and they might go a little manic. And then they're told, see, that's that underlying bipolar we were worried about. But in reality, you rip anyone off lithium and there's a risk of mania, even if they never had it before. And I always tell people that logic to me drives me crazy because it's like if somebody went into some withdrawal from they stopped drinking and they're really tired and they're grumpy and they go, see, depression, start drinking again. This would actually help. Like, how insane would that be, right? So I think you cannot use withdrawal as a criteria for mental health diagnosis. And any doctor that does that is just not using the research to help the patient, trying to prove a point to serve their ego. And that's not in my perspective, that's not really always helpful.
Well, it's terrible for the patient. What a terrible thing. With the alcohol one, you know, it's completely applicable. That example is completely applicable because, say you have severe social anxiety and then you start drinking and that social anxiety goes away and you're the most social person at the bar. You wake up with social anxiety again. Like you said, keep drinking, just never stop drinking. You know what I mean? And you'll never have
All you
social.
gotta do. Problem solved.
Yeah. That's really good. Yeah, no, I think that's important to highlight there. Can we talk the big ones? The big ones are okay. No, one example I want to bring up was there used to be this antipsychotic medication that was used for a stomach ailment, and once the people got off of it, even though they had no previous psychosis, they would have psychotic symptoms. They would they would undergo a psychosis in many of the cases. So I forget the exact details. I'd love to bring those up, but I think that we talked about that with Mr. Whitaker there for the listeners. But it's stuff like that, that should be studied. When we're talking about making scientific claims, to differentiate between the withdrawal symptoms and the symptoms of a so-called mental illness, to make a scientific claim about that, there should be a control, right? So if we're taking larger sample sizes, we should have a control where we assess individuals who do not have any sort of, we say there are no depressive symptoms, and we put them on an SSRI for the same period of time as the experimental group. And we assess both groups and see after we take them off SSRIs, which groups have, and you can control this in many different manners. Now the problem is will that pass an ethical board? I highly doubt putting people who don't have mental illness on SSRIs will pass, but that's the sort of way that the empirical method and scientific method should validate these claims. But unfortunately, unless you've come across some research like that, which I don't think you have, um, these are unscientific claims. So that's really important to note. It's not, you get off depression or your depression's back, go back on the SSRIs. That's very, very important. If there's one thing that everyone can take away from this episode, I want it to be that. That's my thing. So um I'd love to talk maybe more specifically about SSRIs, withdrawal. Because that's kind of the big ones, right? Like that's the big one. You see the benzos and SSRIs. Now, there it seems at least, and you may disagree with this, but it seems like people are starting to realize that benzos have a significant withdrawal period, and like it's kind of admitted at this point. I don't see the same thing with SSRIs. I don't really see that even like from the psychiatrist's point of view. So maybe we could start with SSRIs and then maybe we talk about the benzos.
Yeah. So are you referring to like the withdrawal that comes with SRIs, or I'm sorry, what was the question? Okay.
Withdrawal, sorry, yeah, withdrawals with SSRIs.
Got it. Okay. So most of them are going to do a lot in the GI. So they can cause dysbiosis, they can cause a lot of irritability. So we might see what looks like IBS. So chronic constipation or diarrhea or alternating, gas and bloating. Sometimes we'll see, because of the change in blood sugar that it causes, it's not as bad as the benzos with that, but you still kind of see it. You might see more candida overgrowth that can happen. Um, some people will get colds, like their immune system can shift when they're coming off of it. If they do, if they're staying on it, it's probably okay, but it can actually modify your cortisol levels because when you first take an SSRI, you get a hyperstimulation of ACTH, which overdrives the adrenal system. And then you get really anxious. And then your doctor says, just get through it. Like, just give yourself 4 weeks. You'll feel great. Some people do, some people don't. If you can get through that part, you do feel great. Like, you will, it's because you're sort of getting used to your own steroids. So then once you do that, like, your immune system will be slightly different in what you can react and what you don't react to. So also pretty common to get headaches. Sometimes people get like mysterious sort of sore throats, that kind of thing. When you come off it, then we see more of like the flu-like symptoms, that kind of stuff. I would say some people get worse in anxiety, some will get worse in depression. Suicidal thinking is pretty common. Ironic. Those are the main ones.
Yeah, definitely. And so managing these withdrawal symptoms, what sort of approach do you take? What's your philosophy behind that? Like, you know, um, maybe you could talk a little about drug tapering too, if that's applicable to SSRIs. Um, but is there like any it's hard to be general. It's hard to be general with interventions, but any sort of like underlying philosophy to your approach, I'd love to know about.
Yeah. I mean, for me, a successful taper is not just coming off the medication, it's coming off the medication and feeling like you don't need it or need to go back on it. So we don't want to just take it away and say, hope you're okay with managing the underneath stuff on your own. That's not really going to work. So I do recommend that people, if you are on it, and there's no shame in wanting out of suffering, I tell people that. So if you're on a medication, like, take the time to do the work, because this is just putting a pause on things. It's not curing anything. So if you're getting the luxury of time, use it. Like, go to therapy or do some inner work, inner child work, whatever you got to do. Like, and figure out what it is that got you on the medication. Learn some behavioral tools to manage that. So then when you decide, okay, I don't want to be on this anymore, you have some strategies and some foundational things to help manage your emotions. That's what pills do. SSRIs, they sort of help you manage the compulsivity, the obsessive nature, the phobic stuff, depression. They don't, it's kind of like they sort of give you a pass to not work out your brain, So, like, and that's okay sometimes. We need that sometimes. I definitely did when I was on benzos. The OCD was way too much. Like, even if you put me in therapy, it would have gone away. There's no way I could have sat through that. So, but I guess what I mean is that when I was taking Ativan, um, I didn't have to work so hard to regulate my own anxiety. So that's why when people come off these meds, they're like, oh my gosh, I'm feeling everything. It's so raw. It's because you haven't been practicing emotional regulation the entire time you've been on this drug. What most people do is they go, I'm anxious, and then they take their drug right away. Or they're like, oh, this SRI isn't working so much anymore. Let's maybe alter the dose or whatever we got to do. Or let's add on Abilify. Let's, whatever else. So we do these management techniques, which alters our baseline of stress tolerance. So then that's difficult because if we have low psychological flexibility, low stress tolerance, then coming off medications can be really scary because it goes, wow, I don't know how we're going to do that. I don't know what's going to happen. So the more tools, and some people I work with don't ever want to come off their meds, and that's fine. So if that's the case, then we're still going to work on what physiologically is causing some of these psychiatric symptoms. And then also, let's do some therapy, get a therapist on board. And let's work on all different aspects of your health so that we can get as in balance as possible. That to me makes the most sense for people. Because then if people have autonomy of choice, they go, all right, I feel a little better. I don't know if I want to be on the med anymore. You know what? I feel great. This is perfect. Keeping the med where it's at, like that kind of thing. People deserve that. If people feel that they are a slave to their medication, that they're like, I don't know if I can handle my feelings without, like, those are not good messages for the psyche, to feel like you cannot handle your life, that you are incapable, that challenges your sense of worthiness, your sense of self-love. It's impossible to have good self-esteem with that. Like, that's why most people coming off meds are going to be wrestling some self-esteem issues. Not everybody, but a lot of people do, because you may not think about it every day, but when you swallow a pill, subconsciously, there's something going on with that, and it may be a positive message, it might be a negative one, but it's saying something. So That's my approach, is more, I guess I would say, holistic, and trying to work on all these pieces to get them as in balance as possible so that people can choose for themselves what they want to do.
Very cool. And so do you help support them? So of course it's a holistic approach. I think I know the answer to this. Do you help support like through any sort of herbology or any sort of more materialistic approach? Do you incorporate that into your practice as well? Like you mentioned addressing deficiencies earlier. So like probably things like a proper diet, right? Eating real whole foods and stuff like that. Anyways, I'd love to hear that about that too.
Yeah, I use a lot of nutritional strategies. It might be different per person. Like the nutritional plan I would suggest for somebody tapering is not going to be the one I would tell somebody who just gave birth or somebody who's suffering severe burns. Diets should be temporary. They should be just specific for what's going on and based on the underlying stuff. So somebody tapering an anti-epileptic but has epilepsy would not be on the same diet as somebody who's tapering an anti-epileptic that was taken for bipolar. Um, so I do a lot of that, lots of supplements. So vitamins, minerals, nutrients. I do a lot of botanicals as well, peptides sometimes, NAD sometimes, things like that. I don't do any IVs myself. I don't see people in person anymore. I do everything telehealth now. Um, but I do find that holistic care like this for most people is gentler, and some people are very supplement sensitive. And in which case, there's a lot of other strategies. So there's never only one road to healing. There's a lot of providers out there that are really not into supplements, and they do more like breath work and that kind of thing, and more energy medicine, and that's going to be a better fit for somebody else that, is a little more sensitive. So there's a lot of different paths to get to where you want to go. So that's just so people do what works best for them. And I always relate it to musical instruments. So, like for example, I like supplements. That's my violin. I can play it real well. Somebody else might be like, I hate this instrument. It doesn't work for me. I can never make it sound good. And they're gonna go, but piano's my thing. And I'm gonna be like, I hate piano. It's dumb. So you just do what your voice says to do, and then that's going to be the best strategy to help connect with people. And that's really what healing is just the provider and the client connecting so that growth can happen. And that happens not just for the client but for the provider as well, if it's done, in my opinion, well.
Amazing. Thank you so much for sharing that. That's really an important message. We're and we all get a little dogmatic in our ways too sometimes, eh? Like,
Yeah.
I'm for this or I'm against that, and then it's if you're not doing that, well, then you're stupid or something, right?
Yeah.
Like, I think that's really important. It's about that relationship, that client practitioner relationship, and having a good match is really important, like
Hmm.
you're talking about here. You guys want to sort of be working on the same frequency.
Yeah.
Um, because at the same time, and another thing, and I'm sure you'll agree with this, there's really not much that the practitioner can really do at the same, like, we can help in some sort of abstract and very, very indirect way, but, it's always up to the individual too. And so, like, for the listeners, like, if you are going to work with a practitioner, we talk a lot about the logic stuff here, right? So a lot of them are like, oh, appeal to authority. That's what they might be saying, right? Or appeal to expertise. There are times where it's very appropriate to appeal to expertise, but you as the individual choosing an expert, that's where it comes in. That's where your reasoning comes in. You have to ensure that they're trustworthy. You need to ensure that they're on the same frequency as you, that you kind of align with their philosophy and practice. When I go work with people, like when I like to go see like osteopaths. So whenever I like go in and talk to an osteopath, I ask them about their philosophy, about their approach. Because I'm like, osteopath, you get a different one for every door you walk into. Um, and so it's really important that, I align with their philosophy because I find for me it's what's most meaningful, right? So I think that's a really, really important point because even in the alternative health world, it's interesting. There's a lot of divide in the alternative health world. And maybe that's just natural. I don't know. I don't like it one bit, because I feel like we're all on the same team here. We're all against modern medicine. No, I'm just joking.
Mhm.
but you know what I mean? Like there is just in people, you can take this too broad. I'm getting way off topic with this one, so let's bring it back. Um, with withdrawals, you mentioned earlier with SSRIs that there can be lasting effects. Is there any sort of like detoxification or storage that occurs with this, or is it sort of just stored energy, or maybe more psychological than actual physical storage of these things? I'm curious about your thoughts on that.
I think both. I think psychological in the way that it can be somewhat traumatizing to taper. A lot of issues come up like forgiveness. I can't believe I let this doctor do this. Like, why was I so, that really common. Um, Also not being able to trust your body for a while. Like that is really a lot to reckon with, especially if you feel like no one wants to feel like they're abandoned by the place they live in. It's horrifying. So that very psychological stuff, and that can take a while to reconcile and heal, even after the withdrawal's over. And then the physical withdrawal, the lasting stuff, that can sort of get better. And because I tell people, the withdrawal doesn't end the last day you take your last dose. It's more because it takes a while for the medications to leave the body, for the medications and the inactive metabolites to also leave and excrete through the body. A lot of these medications are they like the resins stay in the fats of the cells, and that takes a while to burn them out. Just like if somebody, you'll hear the kids they'll be like, "How do I get all this marijuana out of my, blood? I have a urine test," and it's like, "Oh well, how long you smoking for?" Because it builds up in the fat, and it's hard to really get that out. And if you release it, you're going to get a hit, just like you release it. So it's not uncommon for people months down the road, like, "Whoa, I feel like I'm tapering all over again." Some stuff gets released out of the fat. Um, I believe memory is also stored in the fat. So I can't prove this, but I think that's where it is because when we think about our fat, it's transducive. It sends energy, electricity. It sends neurotransmission. It also conducts nerves. But when I think of like choline and serine, which are the two most, in my opinion, the most important phospholipids that regulate memory and attention and focus and storage, they have to be in the fat. So when that changes in the body, I'm trying to find patterns in patients, but I do think we are going to see more. We can see more shifts of emotions that change. Um, I'm still working on this theory. Anyways, so that takes a while. It takes a while. We can see it in weight and fat loss, like when people lose a lot of weight, emotions change dramatically, and we can call that, oh, your self-esteem is changed because of your self-image and perception. I don't know if it's that simple. Not entirely just that alone. I think there's something about memory and the fat. Um, the brain also is primarily fat. Tangent, I know, but I think about these things. So, but what you were asking is like how long it can last. And for some people, it can last months, a year, 2 years. It doesn't mean it's going to be horrible for that long. It just means that you might be feeling fine for months, and then bam, you get hit with a random day that feels a little intense. And you're like, oh, I know what this is. It's just moving through. It takes a while. Like cells regenerate, organs regenerate, but that does take some things very short amounts of time, some things take years. So we are always transforming. So that's why like shedding our emotional skin, if you will, and our, these older chemicals, it just takes some time and it doesn't always leave in the order we want it to leave. So we just have to do our best to create a sense of, in my opinion, safety. That's what's lacking for most people that get on a psych med, whether that's like they were feeling anxious or depressed. They were not at their center of a place of feeling safe within their own body. So they need the volume to come down, all these feelings, because it's just too intense. Like they don't like that. So we need to find a way for people to feel safe in the world where they can feel safe relating to others in their own space where they don't feel like they need something else. And that takes, and again, that's the psychological stuff that comes up too. So it all takes some time is the very general answer.
No, that's good. I really look forward to hearing more about that theory, the memory stored in fat. That's really interesting. First thing
Thank
I
you.
thought of when you brought that up, I was like, well, the brain is mostly fat. So that makes a lot of sense. I'm like, that's interesting, really interesting.
Thank you.
Because like a little self-disclosure, I used to like smoke a lot of pot back in the day too, and I remember like my first significant break. You're kind of stoned all the time, and you're stoned all the time because it's stored in your fat, and like
Mhm.
it will leach back out into your bloodstream as you sort of detox it over time, and that's why people will say that that guy's perma-fried.
Yeah.
He's perma-fried because when he's not smoking, he's still leaching THC into his bloodstream. So he is fried
Yep.
permanently, not permanently, but for the time being, until he takes a
Yeah.
break. That's a really interesting example that you bring up there too. So I really look forward to hearing more about that down the road because that's a really cool connection.
Thank you. Working on
Um,
it.
yeah. So like that physical aspect is big, eh? Like that somatic movement experience for detox or helping with withdrawal, eh? That's a big part of your practice too, like exercise, stuff like that.
It can be. A lot of people can't exercise. They lose their tolerance when they're going through withdrawal. Their body's just too sensitive to shifts, and like you exercise, your chemicals change. So, if they can do it, though, it can be really helpful. I mean, research is pretty consistent now at this point that the brain's health is more dependent on physical exercise than is on mental exercises. So while Sudoku is kind of cool and somewhat helpful, that's not nearly as beneficial as exercise or hiking, where you're involving multiple different parts of your brain at once to move through the space. So same with tapering. We always get hyper focused on like the central nervous system, the brain, but that's just one organ system that's affected, and the neurotransmission is throughout the entire body and closely relates and affects the hormonal system, which again is rooted in the fats. So we have to think of the whole body together. We can't just try to go, oh, let's just tweak the serotonin and tweak the like that's just psychiatry all over again, And to me, it just doesn't work because I I always think of it this way: like if somebody is like, oh, I've got low serotonin so I'm depressed. I'm like, no, no, no. You're depressed, so you have low serotonin. It's different. It's not that way. And so that's why when they looked at these people and they, oh, you have low serotonin, let's give people more of a chance. Let's give them an SSRI. Some people felt a little better, some people didn't. You know, if it was a slam dunk, they would have been correct. This is not a blockbuster drug category at all. It's actually a really badly performing drug category. Um, So, in my opinion, like you'll see people going through trauma and stress, and then like you can check, you can look at like, yeah, you have low serotonin. Of course they do. Their system's crashing. Like they're bringing their body, they have to bring themselves down to get out of hyperstimulation. So I think of it more as like a response to what's happening versus like a diagnostic problem to solve. Like no one's running around like I just have low serotonin, so I'm depressed. I really don't believe that at all.
I mean, that's been largely disproven by literature too, the whole
Right. Yeah.
serotonin hypothesis. It was literally
Mhm.
fabricated out of thin air and then
Yeah.
pushed upon. It was that was just the slogan of the pharmaceutical companies back in the
Yeah.
60s, low serotonin deficiency or serotonin, you know what I mean? And there was no literature to back it up. They said, "Oh, it's coming. It's
Yeah.
coming." And then it never came. It never did. And, there's a lot of research on on that being completely untrue. But for some reason, it's such a prevailing idea amongst the people. Like everybody thinks that that's the main connect. And I said, like, I completely agree with you. If there is any sort of, you know, neuro abnormalities in the brain because of that's the result. It's not the cause,
Right.
that's the result. So I think that's a really important thing that we talk about quite a bit too over on my stuff there. Yeah, that's interesting about the exercise. That's a really good point. So what about something as simple as like walking or even light body work, like osteopathy? Like, is that something that you sort of go for? I know
Yeah.
I said exercise, and my exercise is kind of really broad. I even think of like yoga and walking and all of that is exercise to me, right? So, but that lighter stuff probably has a great effect on it too, right?
Yeah. I mean, we do want to get to a point of some hermetic stress, like where we're like, oh, I'm starting to feel an inflammatory shift, but I'm not going into an inflammatory state. And that might mean somebody gets up and they walk downstairs and they walk back up and they're like, yep, that's enough. Like maybe that's what it is. Other people, it, might be a little bit more. So, I do tell people you kind of have to figure out what your stress tolerance is for exercise and movement. And then you don't want to get there and hang there. You just want to almost reach it and then you stop. And that's hard for a lot of people because, like, this is awful. I used to work out all the time. I was an active person and now I can't do it. I know. Like it sucks. It sucks to feel like your body isn't yours. Like this body that you've grown into and accustomed yourself to and made deals with, all of a sudden everything's off. And so it all gets better, but we have to do little things and it requires a lot of work. And I think most psychiatrists don't really understand that. And that's why it's very easy to think of patients as overreacting or faking or having an underlying condition, because the idea that this pill could cause such a systemic overhaul of a person's entire life probably doesn't make sense to a lot of people. And that's very disappointing because to me, it's like being a mechanic and you're like, oh, let's put this part in your car. And they're like, well, it didn't work. Let's take it out. I don't know how. You must be crazy. Like, that's the most insane thing. You should know what you're doing. Yeah, soapboxy, but I just feel very passionately about people that just don't get this information. They don't know what they're signing up for, the deal they're about to make. And again, this isn't everybody, and sometimes the pros outweigh the cons, but everyone should at least have the information to decide for themselves.
The other big issue is that oftentimes it's not psychiatrists that are giving these prescriptions and
Mm-hmm.
diagnoses out, you
It's your
know.
PCP. It's your gynecologist. You know.
Mhm. That's the thing. And you get your 10-15 minute appointment,
Mm-hmm.
there's no time to even discuss the vast amount of side effects that are very common, or the how the literature doesn't actually show that, these are that effective, they're just like marginally more effective than if you did nothing. You know what I mean? Like
Yeah,
they don't even have time to bring that up if they did, right? So of course there's the systemic issue
I
there.
know. I mean, there was
Um,
a study they did. It was 2018 in Cambridge, and they were looking at whether ADHD symptoms improved or worsened after the medication washout period. So, like after the stimulants were totally out of the body. So they took two groups with ADHD, one on the stimulants, one that never took stimulants. And they went through the washout period and they looked at them all twice over 6 years apart. So, like, really long time to see how their ADHD changed with the use of stimulants in one group. No difference. ADHD improved regardless with age because a lot of hormones change. So, verbal memory change, motor, everything shifts during growth, puberty, all that kind of stuff. But the moral of the story is that they made zero difference in long term ADHD treatment, but they're prescribed all the time as a cure for ADHD. And I mean, I don't even think that's necessarily the same as all the other, they're all quite different, but this happens all the time and it happens symptomatically. No one's running tests first to go, oh, we think you need this drug. They go, oh, you have these symptoms. What's my or it's like my favorite SSRI? How about this one? That's it. Like, can you imagine?
that one doesn't work. I got 10 more that you could
Oh yeah.
try. Yeah. No, and I was funny. I was watching a movie on TV the other day. Funny enough, like a movie on TV. Who does that anymore? So all the commercials were rolling through, and um, it was like, well, every time there was three commercials that you saw every time, and there was one that was pharmaceutical. It was a different pharmaceutical drug every commercial break, but there was always a pharmaceutical commercial. And then there
Dang.
was like a beer one and then a betting one. It was always like, you know, classic. Um,
Have a
pharmaceutical, there
drug,
was
have
one
a
that
drink,
came
go to
up.
bed.
Yeah. Yeah. So one of the pharmaceutical ones that stuck out, because God, you just gotta laugh at those commercials now. It's really hilarious to watch them because it's like it's just the most random thing. Anyways, we all know what I'm talking about, the type of commercial. And anyways, this one was I think the starting line was, "Does your antidepressant need an antidepressant?"
Oh my gosh, love
And it
it.
was it was a drug. If your antidepressant doesn't work, you can take another one so that it might work a little better. You know what I mean? I was just like, I was baffled. I was like, don't you think if it's not working that, maybe you're not addressing the underlying root cause of your depression? Like,
I know.
anyways,
Yeah,
just a
it's so
completely
many of
different way of
my
thinking.
clients are like, I've tried them all. So it's amazing. Like they want an answer, they want a solution, they want to feel better. They're trying all these things. It's exhausting. Like, and then the idea that you just haven't found the right. They do have birth control too, like for women that have like PMS or any other hormonal dysregulations. Like, oh, let's try birth control. That one made you suicidal. Let's try a different one. Okay.
You can't blame people for searching either too, right? Like, 'cause they're like in these desperate situations, so it's like so understandable why they're like, because it's also it's understood that there is a magic bullet out there. That's what's told to the people, that there is a magic bullet, so you just need to find which magic bullet's best for you, right? And that's sort of the sad part of the narrative, is that you know people have a lot of trust in this, and they're searching and searching and searching, and they just want to understand. They want to understand, and they want to feel better, and they want to you know and that's the sad part, for me, that is like, it's like an endless search, and there'll always be a new drug on the market, so there'll be a new one. Maybe you just try this one. No, you tried all of them on the market already. Here's a new one, just came out, just fresh off the 6-week clinical trial. It's safe and effective.
I know. It's so true. I mean, naturopathic doctors are rarely anybody's first stop. Like, I do get them. It happens. There's like, oh, my mom's always taking me. I'm used to you guys, That happens. But usually it's people that have tried a lot, seen a ton of people, already been spit out or funneled into psychiatry, like, and just are frankly exhausted, from that system. And so they want something that's better. Most people, when I see them for the first time, and my job is a lot of education. Like I get people that, for example, if it's something as simple as a UTI, we're going to review the pros and cons of the herbs, the pros and cons of the antibiotics. You can choose. And like, Julie, what do you think of vaccine? Like, I'll tell you what I understand about the research. You choose. Like, it's not my job to push treatment on anybody. And that's what I love about naturopathic medicine, is that we're not trying to just give you a band-aid and send you out the door. And while symptom suppression is actually really important, it's more of a team care approach. That's why the appointments are longer, and that's why it's also more expensive, because we're not, most of the time we're not covered, or we can't network with insurance companies. So just the way it is. Hopefully that'll change one day, to make it more doable and accessible for people. That's the biggest criticism, is just it's not affordable for a lot of people.
Well, on that note, I think it might be a good time to wrap it up. I'd love to hear any final thoughts on the episode, anything that you might have missed that you want to add, or anything, any message you want to give to the world.
I would just say, if you are, you know, on a medication, not on a medication, there's no shame in whatever treatment you're considering or doing. It's truly about finding whatever works best for you, because you're the one that lives in your body. And if your doctor is not listening to you about that, then if you can find a new doctor, do it. There's honestly so many out there now that are, I actually had one patient recently who was, oh, my doctor doesn't, she's not going to help. She doesn't support the taper. All right, like, go on to psychologytoday.com, find 10 psychiatrists in your state, copy and paste the email, tell them right up front, you want a taper, you want support. 5 got back to her and they're like, absolutely happy to help oversee that for you. But, if your doctor's got an ego and it's like, no, like, find someone else, and that's not just MDs, that's anybody you work with, like, whatever. If you're not connecting about whatever you're wanting to work on, like, try to address it. Tell them, if you feel comfortable, like, hey, I don't think that's right for me. See if they'll work with you, always, if you feel safe, do it. And then if it's just not working, like, try to find something else that is going to work.
Really good message. I love that. And I think that's really important, trying to find, if you're going to work with somebody, like make sure that they align with you and your philosophy, and it's all about you, the individual. That's what it's all about. And the practitioner, their primary, as a practitioner, their primary concern should be you as an individual, right? Like they should, like in a way, they need to omit their worldview completely. And that's one of the things that I actually appreciate about the program that I was in, because that was talked about a lot, and it's in our code of ethics, and it's about it's not about you. It's about the client. It's about the individual that you're working with. And I think that's a really important message. Whether it be psychotherapy, whether it be, going to see an MD, psychiatrist, psychologist, a naturopath, osteopath, massage therapist, whatever, making sure that they align with your philosophy, and people generally are eager to talk about their philosophy. I say, what's your philosophy approach to this? Whenever I go talk to a practitioner of any kind, and usually, if they're in it for the right reasons, if they're not in it to just make money, they're really happy to talk about that because it should be something that they're very interested in. So that's what I like to lead with. But
Yeah.
anyways, that's really great advice. How can a listener support you and find your work, learn more from you, social medias, websites, stuff like that?
Yeah, I am on Instagram at Dr. Julia Britz. My website is drjuliabritz.com. I try to keep active on my blog there. I try to, give out a lot of information for people to be self-informed. And if you want to work with me, I do see people via telehealth. So you can learn more about that on my website, or you can DM me on Instagram.
Very good. We'll put those links down below too for the listener. That's great, Dr. Britz. Thank you so much for coming on today. I really appreciate your time and all the wisdom that you shared.
Oh, thank you so much. It was my pleasure.
I want to thank you all for listening. You should all know this is not medical advice. This is not psychotherapeutic advice, not psychiatric advice, not taper advice. This is not advice whatsoever. This does not replace a relationship with a primary healthcare practitioner, the MDs. This is for your informational purposes only. But also remember that we're all responsible, sovereign beings capable of thinking, criticizing, and understanding absolutely anything. We, the people in the greater forest, are together self healers, self governable, self teachers, and so much more. Please reach out if you have any questions, criticisms, comments, concerns, whatever it is. You know where to find me on Instagram there. I love to chat with all of you. Let me know what you think of the episode. I really appreciate all the feedback you guys give me. Um, and yeah, if you did find this informative in any way or you enjoyed it, give us a like, comment, follow, subscribe, whatever you got to do on the platform you're on, and share with your friends, families, strangers. Go and tell your mailman, everybody. Sharing is the best way to help support me. So I really appreciate y'all for taking the time to listen today. And just remember, there are two types of people in the world: those who believe they can, those who believe they can't, and they are both correct. All right, guys. Thanks for listening. Take care.